Hi, everyone, and welcome to Our Health Legacy podcast, brought to you by the First Ladies Health Initiative. I'm your host, Taylor Alston Cleveland. This podcast series was partially funded through Patient-Centered Outcomes Research Institute, or PCORI. The views shared by our guests are their own and do not necessarily represent the views of PCORI. Today, we're talking about something many mothers experience, but don't always talk about openly: breastfeeding. For many women, especially Black mothers, the desire is there, but the support, guidance, and resources aren't always. Research supported by PCORI shows that when mothers have access to peer support and lactation care, breastfeeding outcomes actually improve. So it raises this bigger question: is breastfeeding about individual effort or about whether the system around a mother is built to support her? Today, we're going to unpack that gap between what mothers are told to expect and what they actually experience, and talking about what real support looks like. I'm joined by some incredible women who are doing this work in meaningful and impactful ways. First, we have Christelle Acuna-Pitts. She's a certified lactation specialist and nurse navigator with Melanated Group Midwifery Care at University of Illinois, Chicago. Next, we have Dr. Sharish Chambers. She's a board-certified OBGYN and a maternal health advocate and author. And last, we have First Lady Dana Posley, who's the First Lady of Pleasant Green Missionary Baptist Church here in Chicago. Lady Posley was also a former certified lactation counselor with almost 30 years of experience. Okay, well, thank you, ladies, for joining us today. So let's get started. I think what will be helpful is to sort of just ground us in this discussion. There's a reason why women want to breastfeed, and I would love to hear from anyone's point of view. Why is breastfeeding something that is desirable? What are the medical benefits of breastfeeding, both for the mother as well for their babies?
I would say, I believe most of us want to breastfeed because we want to have that bond. We want to have the bond with the baby that we've held for 9 months, and we want to have that on the outside, and we want to care for them the best way possible. They were given to us by God, so we just want to take care of them. I think breastfeeding is one of the first things that we think naturally that we can do.
And to add on to that, there's so many health benefits, both for mom and for baby, to breastfeed. For one, I think a lot of people don't realize how exclusive breast milk is. It's like exclusive to that baby, that little person who is latched onto you. And so it has a lot of antibodies, living organisms that formula just cannot produce. And then also, like you said, bonding, the flu season, there's a lot of antibodies in breast milk. So it's really helpful to help with sicknesses. And actually studies show that babies who are breastfed later on spend a lot less time in the hospital. Yeah. And then in addition to that, for moms especially, breastfeeding contributes to decreasing your risk for diabetes, for hypertension, for a lot of things. So
Yeah, I just want to add on to that. I think it's our desire to just show up for our babies as much as we can. And that feels like one of the ways in which we can be present and also supporting their health. And it just kind of makes sense in our minds, right? I do want to highlight that expectation and reality don't often align, but the desire within moms to breastfeed, I think, is inherent to that maternal bond.
Let's talk a little bit about expectation and reality, right? So breastfeeding is often described as something that comes naturally, but for many mothers, it's one of the hardest parts of early motherhood. So can we talk a little bit about why there's such a gap between what's been told to us about breastfeeding versus what mothers actually experience?
Oh, man. It's crazy for me because I have a 1-year-old, and so I just went through this. But I remember the first time I tried to have him latch, and I was like, this is one of the most painful things that has ever happened. Not just because of the latching, because we did have some difficulty with that. Thank goodness I had a good lactation specialist to help me. But because of the contractions that happened, the uterine contractions that I'd always, as an OBGYN, said, oh, that's so great. It's helping your uterus contract. That's good for bleeding and recovery. Yeah, but it hurts, right? And in my little bed, I was like, no one told me this. And I was like, wait a second. I was the one who used to, like, I am the ops, right? For lack of a better term. So that was shocking, the expectation aspect in reality for someone who was trained to do it. And I think trained and proximity is not the same as doing, and it is different for each person. So I was surprised immediately. I'm talking about first 24 hours, just from the discomfort of this beautiful thing that I've been waiting to do.
And then too, I don't believe if there was more prenatal conversations around breastfeeding, then that helps you mentally deal with the challenges that are going to come, because then you're told about them. You're actually able to have those conversations and discuss your concerns and then get the real picture. Because yes, if you didn't tell, you're like, yes, I'm from a medical perspective. Okay, yeah, you're going to feel the pain, but no, you're really going to feel the pain and you're going to want to stop. But because I was told about it beforehand, then maybe my expectations are, I can realistically set those expectations and know not to jump or flinch and be like, okay, we can make it through this. It's just for feeding. But I believe more prenatal education on it works best for that mom that's going to experience it, but then those people that are around her as well too, so they can encourage her on, you can make it through, and it just gives you something to look to and know that you're not crazy in that moment.
Yes.
So.
I'd like to add that when it comes to expectation versus reality, there is nothing like reading something versus experiencing it firsthand, right? Yeah. It's kind of like you get your training as a professional in school. There's textbook, and then there's in the field, right?
Yep.
And so from my own personal experience, so I have 2 children now. One is 3 and the other one is 8 months. And I actually tandem fed, which that just means I breastfed them both at the same time, too, for a period. My 3-year-old just stopped in February. Thank you. But where I was going with this is that for my first experience, I am an OB nurse. I worked in labor and delivery and postpartum. I educated moms at the bedside. Yes. I was like in the trenches with them, trying to get them the latch and help them before they went home. And then I thought that I totally understood that there was going to be, I'm going to be tired. Like, this is going to be some work that I'm going to have to put in, right? And I was like, I teach this. It's going to be good. And then my turn came, right? And when you're in the trenches of sleep deprivation, and when you factor in your mental health and capacity in those moments, and I had my baby in the winter, I'm just saying, that's something different, okay? Yeah. So I think the expectations of what you see on social media or what your grandparents or what you see in your community is very different once you're in it. It feels different. And so when you're in it, you're like, well, nobody told me this. Well, is this how it's supposed to feel? Is this right?
So when we talk about, breastfeeding disparities in our community, in the Black community, what are some of the biggest drivers of these gaps, based on your own experiences?
I think I would lead with lack of support. And when I say support, it's not that we don't have lactation specialists and all those things. It is like systematic support within the community of people that our patients and these moms interact with every single day. So it's one thing that I can go to the hospital or to my physician's office or my midwife's practice to get this care. But what about the home I'm in? Like, what about the job I go to? What does it look like to have a boss or a colleague that meaningfully supports this and doesn't just say they do? And so I think that is a major gap that has to be acknowledged if we're talking to anyone about breastfeeding. Just putting it out there without giving them the support and like the systematic support is really setting people up for failure, in my opinion.
Yeah. And I would say when I did the breastfeeding support, I encouraged their village to come with them, because that's who's going to be with you in the middle of the night or when the doctor office is closed is your immediate support system. So whether it be dad, whether it be mom, best friend, they needed to come to those breastfeeding classes with you, because then they need to know as well things that you're going to go through, but then they need to learn their role in that support. And their role can be something just as simple as turning the TV on for you while you're holding the baby, or getting you something to drink while you're feeding the baby.
Because I'm hungry.
Every time.
Yes, right.
Burning calories
very
actively.
hungry. You're hungry, you're thirsty. And so just knowing that if they know that as like their second nature, that this is something that they should be doing for you,
Yes.
it helps tremendously. And yeah, so if you can bring that circle of people around you to give you that support, it helps tremendously. Yeah.
Yeah. My sister set up my breast pump for me, my older sister, which made me like then sad because I was like, you don't have an older sister. Like,
She was oldest,
I'm
right?
so sorry. You're right. She stepped in, for our mom. And so she
Yeah.
was like, this is how you set up your breast pump. And the way I don't know that I would have been able to do that. I was just so depleted. And so putting together parts, I hate assembling anything, right? So it just felt so complex. And she was like, no, this part goes in here and this goes in here. You have to make sure that this is plugged in correctly. And she set it up for me. And that was a huge barrier that I'm only recognizing in this moment that I didn't have to do alone, that would have potentially been discouraging.
Yeah.
Yeah.
And I think a lot of, especially Black moms, they don't see representation in the breastfeeding community often, whether that's peer or even if it's a lactation consultant, right? Or, lactation peer person. And in addition to that, I just think that it goes even deeper than that, right? So I was just saying actually to these ladies earlier how I didn't realize how much of a privilege it was for me to be able to breastfeed as long as I have been breastfeeding. To be able to, with my daughter, I took an entire 11 months off from working. That whole almost first year of her life, I didn't have to go to work. I didn't have to worry about, is there a pumping room? I didn't have to worry about, well, am I going to be leaving late because this? Or am I, I didn't have to worry about a lot of things. And what a privilege, right? So there's gaps in so many ways, even in employing, finances. There are moms out here going back to work in 2 weeks.
Yes.
Yes.
You're absolutely
yeah.
right.
You're exactly
absolutely
right.
So many mothers leave the hospital feeling confident, but then within a few days, a lot of mothers feel overwhelmed. So from a clinical perspective, what typically goes wrong during those early days at home?
Imagine you go from being in a hospital where all eyes are on you, you have the support of usually now, most hospitals have a lactation team or a lactation consultant there, right, that sees you at least once before you leave. You have your nurse that's coming in. You have all these people that are there supporting you in this. And like I said earlier, me, myself, being a bedside nurse, I was in the trenches with these patients trying to get this down. This journey started well. And then you go home, right? So you have your baby. You're in the hospital for a couple of days. You go home. Those first 2 days after a baby is born, it's a lot of sleeping. Okay, it's a lot of sleeping, and you eat and you go sleep, and then they go home and they're cluster feeding, right?
Yes.
So cluster feeding, like they're feeding every 30. I'm like, I just fed you 30 minutes ago, and you're hungry again, right? So then there is this myth out there, actually, where people are like, you're starving your baby, right? Or you as a parent, it's not like you have the capacity, the objective, right, capacity to do measurements, especially if you're only putting the baby to breast. You don't see how much is coming out. And that's by design, y'all, okay? But nonetheless, all you're thinking is, well, something's wrong. My baby's crying. I'm not giving them enough, right? So it starts that breakdown there. That anxiety starts creeping in.
Yes.
And you're like, you don't know what to do. And you're the mother, right? And there's this beautiful image of the maternal instinct. The baby knows what to do. The mom knows what to do. And then you're in that scenario at 2:00 in the morning, and you're like, I don't know what to do. I've tried everything.
Yeah.
So it starts there. And then not only that, pain pain is a huge driving factor for the cessation of or shortening of lactation journeys. Like
Yes.
people are out here in pain. And though we do expect some soreness, though we do expect, the initial latch might feel a little painful, a little pinching, but that should subside. Moms are really out here just going through it. And I think that also ties to the strong Black woman, right? You just keep going. You keep pushing. This is what my baby needs. This is what we need to do.
Exactly.
So I just do what I have to do. And this is what that looks like.
Yeah. I think, so sorry. Yeah. I think there needs to be a balance in like sharing the reality, right? You don't want to share the reality so much that people are like, I don't want to breastfeed. Like that sounds barbaric and terrifying, right? Hello. But also sharing the solutions. And so I had friends that were moms that were like, your nipples are going to crack unless you are thoughtful and proactive about using like nipple balm like every time. Like they were like, every single time. So I knew that there was something I could do. And so the information was paired with action, and that made me feel a little less alone. But to add to kind of the what goes wrong in those early days, the hormonal changes cannot be ignored. So you are overlaying this complex kind of picture where you have a new human in your life, right, that is dependent on you entirely. And you have these personal expectations you have set on yourself that may not match reality. Then you've got sleep deprivation, which in and of itself creates all sorts of foolishness. And then you have the plummeting of hormones. I mean, a drastic tenfold decrease of hormones from time of delivery to when you go home. And your body is just trying to figure out which way is up. I have never felt more disoriented than I did postpartum. And I thought, because I'd done call, right, little 24-hour shifts in there, 32, if you will. I was like, I've been sleep deprived. Guess what? Somebody always came to relieve me. I am my relief, right? And when I put that together, just that feeling, that acceptance of reality, that shift of reality, like, oh my God, how do people do this? I remember feeling that. Like literally, it feels like you're set up to fail. And that's hard.
And I think, too, that setup to fail, for me, again, it always goes back to what did you learn beforehand? Because a lot of the pains, besides the uterine contraction that we can't stop, the other pains, there are some pains that you actually can prevent. That would be like the latch. Most people don't know. The one thing I used to tell a mom is pay attention to your baby in utero. What is their favorite position? What is their favorite side that you like to lay on? Because they will let you know, hey, mom, wrong side. Flip over. And take that and put that on the outside. When they come outside, apparently like they like to lay on their right shoulder, on that right side. Okay, so put that baby where their right side is facing down toward the floor. They'll give you a better latch. So that things like that, if you bring that to their attention, then they're like, oh, okay, because some people are like, well, I tried to do this side. We're all our own individuals. We come out individually. We think individually. I don't like that, Mom. And so I'm not going to give you what you think that I should be giving you right now because I'm an individual person. And so I think if you can have those conversations beforehand, that reality does not seem as scary.
Yes.
Right.
Yes.
It does not seem as scary because then, so I can do this without as much. Yes, you can without much horror. You can. You actually can. You actually can do it. Yes. So, yeah.
So I guess to that point, what are some questions mothers should feel empowered to ask their provider before they actually go home so that they are better prepared?
For me, I would say if I need to contact someone at the 2:00 hour, is there someone available? It may not be from your office, but do you have some type of contact information that I can just reach out to or refer me to nowadays we have apps, refer me to an app or a website that I can just go to and maybe get that information right then and there. because it really is that 2-3 o'clock hour where you're flustered and you just don't know what to do. I'm okay 9 to 5, but in that midnight hour, that's when you need it. That midnight hour hits different.
It's different.
I always tell my patients the parameters in which I want them to reach out. And so there's obviously just growing pains, and you're learning your body and you're learning your baby, but this is where it ends. This is where you actually need to get help. So when you've got terrible signs of like mastitis, for example, and you've got a fever and you've got chills and swelling and tenderness and redness of your breast, like, you need to talk to someone. And so I think it's important to ask, when do I need to come back? When do I need to make the call? Especially to kind of combat that strong Black woman trope, because we will push through otherwise. We're like, well, we thought it was normal, because we have no idea what normal is. And so when you're just sitting out here and you're like, everything is crazy, that is not a good enough indicator of when I need to call someone. You feel crazy. Well, I would have called you 12 times last night. What do you mean? Like, I have felt crazy for the last 72 hours. I can't call you with all of those things. So I need real and concrete examples of when I need to call.
And resources. I mean, especially depending on where you're living, resources can be scarce. And so to have a list of some places that I can go to that will support me, or even like support groups, because you could get a lot of resources and advice within support groups from your peers. So, yeah.
At what point should a mother reach out to get professional lactation support?
I think the general guidance is when their baby is not gaining weight or losing weight more rapidly. Those are some of the markers in which we say, hey, maybe we do need some lactation support here. I think complex medical histories or complex physical changes and differences. Some people have had prior breast surgery. Some people have differences to their nipples and things that may make breastfeeding more complex than just the standard kind of style of breastfeeding. And then people like myself who have like chronic medical conditions that may change the ability to produce and the hydration and all those balances and things. But also, if there is a moment in which we are teetering into diminishing mental health, that's always a sign and a time to reach out.
Can each of you all share a moment in your work or even in your personal life that sort of changed the way you think about breastfeeding?
Well, you know what? I already said, once I was in the trenches myself, that them lenses looked a little different, okay? So I personally feel like once I started my own breastfeeding journey, so just to give a little background, my daughter was born at 36 weeks, and so, and they were like, she's lost too much weight. In my own opinion, I was like, y'all scaled wrong. But then that started my pumping journey. And I was pumping after every feed. And that, what comes along with that, I didn't realize how taxing a lactation journey could be. It could be very emotionally taxing, physically taxing, and the capacities that we have are all different. And I, like I said, was privileged enough to be able to take off 11 months from working and have a partner, a family, a really good support system. And a lot of people don't have that. So to sit in that and recognize that I struggled in some ways, even with all of those resources, it was mind-changing. And in addition to that, you mentioned earlier that I work as a nurse navigator with Melanated Group Midwifery Care over at UIC. And in this role, we follow our moms for an entire year postpartum. I've been a nurse for 10 years now. And for a majority of that time, I spent at bedside, and I saw my patients at bedside. I saw the struggles at bedside. I helped them through, and I'm like, yes, this is a success story because we got the baby to latch in the hospital, and now they're going home on a great start. And I genuinely didn't realize how short a lot of people's lactation journeys are because of so many gaps, so many lack of resources. That was really mind-changing. or like it really opened my eyes. Being in this position and being able to see firsthand what all of these parents, these moms are going through, and to go in with the goal of having a lactation journey of 3 or 6 months, but then life hits you in ways that you didn't expect. And you're so accustomed to pushing through that you thought you were going to be able to push through this, and then it's not that, got a little emotional thinking about their experiences.
Yeah. I would say for me, the thing that shifted the way I thought about breastfeeding was when I realized that I just wasn't making enough breast milk for my son. And I think I'm historically a very logical person. Like I always just thought, you have a baby, just I'm very logical in my approach. So I was like, of course I'm going to breastfeed, duh. But there was something in me that was just putting unnecessary pressure on myself. And my sister was like, there's nothing wrong with supplementing with formula. And I was like, I know, but I just think I can do it. And I just wanted to be able to do it. And I knew there was no trophy for this. There was nothing special. It was just this special pressure I was putting on myself that I never thought I would do. And I think you just don't know who you become on the other side of motherhood. Like your brain is actually rewired. You are different. And I almost didn't recognize myself. Like I became the person that I used to not be able to understand. It's like, why is she crying about breast milk? It's like, it's fine. We got formula. But it was something about being able to do that for my child and being able to walk in this role fully and almost perfectly that I didn't realize I was just pressuring myself to do. And when I did supplement at 4 weeks, it was so good for my mental health. I stopped worrying if my body was going to make enough because I had no control over that. I was trying to drink as much water as possible. My friends were making me lactation cookies and things. And it just took off this pressure that I was putting on myself. And I think that changed my understanding and my grace for the emotional aspect that doesn't have to abide by logic. It is something that can be deeply personal, that you carry and you don't always name or recognize, that makes things heavier than they should be. And it's important to hold space for those people and hold space for that emotion and not dismiss it, but also provide solutions like my sister did. You can supplement. It's okay to supplement, and just gently said that to me until I did, and I was relieved.
For me, it was, I put a lot of emphasis on the village support. And that came about because my husband was the most supportive in my life when it came to breastfeeding.
Oh, that's amazing.
There was nothing that I would need that he wouldn't provide. He had his own selfish reasons for breastfeeding, but it worked. His reasons is the funniest thing. His reasons was, hey, it's free.
Okay.
So,
logic.
Yes. And at the time he was in the military, and he would start going and talking to his fellow sailors about, hey, your wife is pregnant, she needs to breastfeed. So he became an advocate of breastfeeding.
Wow.
When we moved back here to Chicago, he did this, the Chicago breastfeeding blueprint. He sat on that panel because he really is all about, you have to give the support of your mate what she needs, because it does not just helps her and the baby, it's gonna help you. And so that approach that he gave me, I realized that is what kept me going. And I think because my last one I did 3 years as well. We went. His birthday came and he said, "Oh, I don't need it." You're right.
Oh, he told you
don't.
that.
He told me that. That was the happiest moment of my life.
Right.
But it was that support that allowed me to even think that I could go for 3 years. And I think when we have those personal people, our villagers that really take on responsibility for us and our success in what we want to do, that's where it is. And so I'm a big advocate of getting all of your villagers to actually stand with you, hold you up, when you need it, because you're going to need it during this time.
So on the topic of community, I do want to talk a little bit about our faith community, because those are places that, it's a trusted space. How can churches and community leaders be supportive of mothers during this time?
Include the education in when you host the health fairs. Include that education. Don't leave it out. Create the space, if needed, in the actual church for a mom. So not everybody is as comfortable. I was very comfortable. Have no problem breastfeeding wherever we were, but not everyone is like me. So creating that space for them to go, having the congregation know, hey, if you see something, don't make them feel weird about it. So I think if we can do those things, that's how you normalize it. That's how you normalize it. That's how you embrace it. That's how you encourage it as well too. And speaking from the pulpit of saying, hey, it's okay if this mom does this, or when you start telling stories of the Bible, you know, throw that in there, because we know there was no formula then either. So she had to do what she had to do.
That's a good
So,
point. Yeah, my church actually built a mother's room that they didn't have before, because there wasn't anyone that was, breastfeeding at the time. But when I was about to return after my son had gotten his shots and everything, they were like, oh, yeah, we have a whole, breastfeeding room with this comfortable recliner, a little breastfeeding pillow. It was right next to a changing station. And they really did this because they knew that I was about to deliver and that I would want to return to church. And they just made it easier. And that was so kind. They even asked me, they're like, well, we're going to get all the input, of all the moms that are going to use this, which was me. And they were like, is this recliner okay? I was like, that's amazing. But just that thoughtfulness of saying that this, because it matters to you, it matters to us. And they prayed over me during my pregnancy, but just that thoughtfulness for what it looks like beyond this and the support, that meant so much to me. It really, really did.
At my church, at a church that I used to go to, actually, they also had a mother's room. And they had a nice big screen in there, too, so you could still watch the service live. So you weren't missing the message. It wasn't like you're either here, you're either here for the message or, you didn't have to choose. Right. You still got to be in that capacity and still receive the word at the same time.
Which is so nice. It's so nice. I heard someone say, because just having a young kid in church, I think, can be challenging, and just the things you're balancing with having a baby in church. And I heard someone on social media say, it feels hard when you're a young mom and you're missing church and you have to walk out and care for your child and all of those things, even if there's a screen, the attention is kind of divided. And they're like, well, this is your ministry. And I remember thinking about that, this is my ministry right now. I am being a good steward of what God has given me in the context of being in church. Yes, I may have missed the third point of the sermon, right? Or I wasn't able to participate as much as I wanted to in praise and worship or something like that. But I'm doing my ministry. And that viewpoint helped me.
What advice would you all give every Black mother who's listening about just asking for help and building that support system?
Advice I would say is just ask. Just if you see a mom, just ask a mom. Everyone has a breastfeeding story, whether it's a good one or a bad one. It is a story, and there's something for you to learn from it, whether good or bad. You're going to learn from it. And you just never know who is in your midst when you ask a question. You never know what their network looks like, because your question, they may not be able to answer your question or give you guidance, but I might know someone. I might know someone that can actually help you. So when we talk more and we seek out advice, we'd be quite surprised at the plethora of information and wisdom and knowledge that is in our circle that we didn't even realize we had. And then now our circle can get even larger. So, yeah.
I agree with that 100%. And in addition to that, I'd like to add that take it one step at a time. And asking for help can feel like such a burden. It can feel so heavy. It can feel like you're a failure. It can feel like so many things, right? But how we get better at things is we practice it. So even if it's something that you don't need help with, like I'm perfectly fine getting my water out the fridge myself, but they're like, "Can I get this water for you?" Practice just saying yes, even at those little markers. It doesn't have to start big if it doesn't feel comfortable for you. But in order for you to get to a place where you feel okay asking for help and receiving it, you have receiving it, you have to practice saying yes. And then lastly, just 1 feed at a time, girl, 1 feed at a time.
Yeah. I mean, my advice, it sounds so cliche, and people always, they told me this before I delivered. Give yourself grace. But I think, again, the act of doing so, I think it has to be a repetition thing. Like you have to say, I'm okay. It's okay that I have to use formula right now. Or it's okay that my husband has to do this wake up. I'm too tired. Or it's okay that I'm going to close the book on my breastfeeding journey. I'm proud of myself. And I had to reframe that. I was like, I'm so proud that I was able to nurse with my child and to do it longer because of the supplementing, honestly. And I'm proud of these 6 months. So proud of myself. And just reframing it for you. Yes, it's beautiful to be able to do a year. Or for some people, they're like, I got those solid 6 weeks and I am proud. Some people are like, I need that colostrum to get to my baby, right? Whatever your goal is, whatever it is, leaning into that, being proud of yourself for doing it. It is such a beautiful gift. It is such a sacrifice to do. And so just reframing what you are able to do and what your body's capable of, being okay with that and giving yourself grace is critical for this season.
Can I add? Yes. It's not necessarily an advice directly to the lactating person, but to the support system, especially the women who are there supporting. It's really important to not project your own goals, your own experience onto these other people's journeys. And also how we measure success in our lactation journey is very individual. It's very exclusive to not even only every person, but to every experience, even within that same person. So just keep that in the forefront anytime you're coming to give advice that's unsolicited. Okay. I know we can't ask you. No, right. I'm just kidding. So yeah, that's my little 2 cents.
That's so good. That's so good.
That is really good. And my last question is actually tied to that because we were talking about how breastfeeding success is tied to your community. It's not an individual effort. So before we close, what role should families, girlfriends, partners, providers be playing to make sure that mothers are set up for success?
I think she started really well with saying the prenatal education is a really good starting point. I think that hospitals need to really start partnering more with having like IBCLC not be an optional part of staffing, but this is what you get no matter what. Everyone gets this. Yes. And integrating doulas, right? Insurance, you guys play a role too. Can you cover my visit? Can I have unlimited lactation visits? Can I have unlimited doula services? All of those things play a huge role in the longevity and success, whatever that looks like for your lactation journey.
I would say, and the village needs to be asking the mom pointed questions, not just how are you doing, but how is breastfeeding going? Like, are your nipples hurting? Have you had a clogged milk duct? Do you have pain? Like very specific questions, and not just to be intrusive, but saying maybe, you know what? I was so shocked when I had a clogged duct. And the only thing that would work it out was standing in the shower and massaging it. Has that happened to you? Have you happened to have that yet? Because sometimes moms don't feel comfortable saying, oh, I'm in pain right now. Like I'm feeling something or this side hurts today. And so sometimes asking things like, I experienced this. Has that happened to you? Normalizing it, saying, it was really hard for me those first 2 weeks. Has that happened to you? So one person I just remember who didn't do anything terribly tangible for me, but it's my husband's grandmother. It was like 86. She would just come up to me and she had, I believe, 8 kids. And she would hold both my hands and say, and how are you? And she would look at me with these knowing eyes of someone who bore 8 children, who knew just all of the things. And it was like she was asking and telling me things that were unspoken. And I'd be like, I'm doing okay. And she'd be like, you got to take care of yourself. And I was like, I know. But it was something about the sincerity of the question and something about I know what you're going through and I'm with you, like this, you're a part of this motherhood thing. For some reason, it just felt like a hug for me. And I needed it. Every time she asked, I was so pleased. Even though my answer didn't really change. I was like, I'm okay,
No, I think the ladies hit it.
Can I add one more though? Community like hubs for lactating people, especially on the South Side, or in places or West Side where there's lacking in resources and community and village, because a lot of people don't have the village. A lot of people don't have the support. A lot of people don't know what questions to ask. A lot of people don't know what's normal, what's not normal, and they think things like breastfeeding being painful is normal, and it's not. So building more spaces within the community so that moms can have a space that feels safe to let go of all of what they're feeling, because they're not the only one that's experiencing this.
Are there any resources that you can share for our audience who may need that additional support?
I'd like to point out in Hyde Park, Chicago Birthworks Collective, their maternal health studio, and they go from point A to point Z. They cover it all. And every Thursday from 2 to 4 p.m., they have a lactation lab where there's IBCLC or lactation specialists or consultants where you can go and you don't have to pay anything. You go, you bring your partner, you bring your baby, you bring your pump, whatever. And and it doesn't have to be that you just had a baby and you come. I was going and my baby was already eating food. My baby was already talking. So, it doesn't have to be, my baby's already 8 months and eating food, or I'm already weaning. Come, let's talk about how weaning is going. Come, let's share your experience, because I'm going to be weaning soon too, or I struggle. Tell me what's working for you, so yeah.
Here in Chicago, we have the Chicago Region Breastfeeding Task Force. It consists of professional providers as well as moms and community workers. They can go to that. Your local WIC office. Every WIC office is supposed to have breastfeeding support. So they're not just there for pushing formula, but there are people there that are meant to actually help you with breastfeeding. So you can go to your local WIC office. Also, a good thing is find your nearest baby-friendly hospital, because they do host events and they have peer groups, support groups for moms. Yes, and they're free. And they really do put an emphasis on breastfeeding. So if you know you want to breastfeed while you're pregnant, if you can get to a baby-friendly hospital, that makes a huge difference in the way they treat you from the time you walk in to the time you leave. So that makes a difference as well, too.
Yeah, I was going to say the baby-friendly thing because I took some virtual classes beforehand that were completely free. And then when I was leaving, they gave me, a list of all the resources. You can take classes here, you can call this number here, you can return here, and we can make appointments for you here. And so I would say local support really does matter, certainly. And then, I'm not above this. The social medias of the world can have some good support there, especially as it relates to representation. And so just looking at like breastfeeding moms on TikTok and things of that nature, I think just the visual of seeing people like nurturing and breastfeeding their child, especially people of color, people that look like us, is important. So if you need those visuals, seek them out.
There's Blue Door also. Blue Door has a lot of resources and events that they put on for families in general. It doesn't have to be in the family realm, but also for breastfeeding support, they have a lot of resources. And then, like you said, a lot of hospitals also give free prenatal classes that
Yes.
include breastfeeding support as well
Yeah.
for both you and your family.
Right.
Yeah.
Oh, and there's also free pumps. So most insurance covers like a free pump. And I had a friend who sent me a website that I can't recall, but most of the insurance are going to cover your pump for free, but you have to ask about it. And so I got mine sent to my house, and it was completely free, and that was amazing.
Aeroflow, actually.
Yes.
Aeroflow and Neb Medical.
I think it was Aeroflow that I
But
used. Yeah.
Aeroflow, they work with your insurance. But what I really love about Aeroflow is that they also offer a bunch of free online resources and
Yeah.
class and webinars that you can go on while you're pregnant, whether it's about I have a planned C-section, so they have a webinar about C-sections.
Yes.
Or I plan the pump but not latch the baby. They have webinars about that. And so, that's another thing. And those are free, covered by insurance.
Yeah, Aeroflow is what I used, and they reached out to my doctor, got the whole prescription and everything, so that was covered perfectly. And I was like, huh, that was easy. Yeah, that was nice.
Yeah.
Well, this was wonderful. Thank you all so much for sharing all of this helpful information, resources, just insight. I know that our listeners feel more supported. And I think for us, we want to just make sure that mothers know that they're not alone in this, that there's a community there to help, and we want to be that support for them as well. So thank you all so much. We would like to send a heartfelt thank you to each of our panelists for this crucial and candid discussion. For more resources and ways to engage, visit us at firstladieshealth.com/maternal health. And also help us amplify these voices by sharing this episode with someone who needs to hear it. You can connect with us on social media by following us at First Ladies Initiative on Instagram. This podcast was partially funded through Patient-Centered Outcomes Research Institute, also known as PCORI, Dissemination Award. The views, statements, and opinions presented in this podcast are solely the responsibility of the speakers and do not necessarily represent the views of PCORI.